Hello, my name is Connor Hanrahan, and I'm the current System Director of our PGY1 Pharmacy Residency Program for the Utah-based residency in Intermountain Healthcare. I also oversee medication policy and drug stewardship for the organization, but one of the favorite parts of my job is working with the residency program. So today during this presentation, we'll talk a little bit in more detail about the PGY1 pharmacy program that's based out of our hospital facilities. So specifically what we'll do is I'll kind of start with an overview of Intermountain Healthcare in general, tell you a little bit about the organization as a whole, and then we'll talk about the programs that we have specifically within the Utah-based area and what those look like, locations, things like that. Then I'll transition that to telling you a little bit about our residency purpose and vision and what I think makes us unique and why we can really add value to residents who rotate with us. And then we'll wrap up talking about some of the program requirements for the PGY1, the hospital-based programs, and then I'll talk to you a little bit about the matching process and what that looks like. If you're not familiar with Intermountain Healthcare, it's a pretty large integrated delivery network. And what that means is that we own a lot of things, and for many of our patients, we can really care for them throughout their continuity of their life cycle. So we have, of course, our hospital facilities. We're up to 33 hospitals now across 7 different states. But we also have nearly 400 clinics. We have a home care and hospice. We have an aligned payer called Select Health. That's our insurance arm. We have a specialty pharmacy. So we have all sorts of different things that can really care for patients in an integrated way. And that's really of benefit to residents rotating within our organization because it's important that they understand how practice works within a large integrated delivery network, since that's where most of the healthcare sector is going right now. There's a lot of consolidation and growth. And so doing your residency program in a large IDN like Intermountain will really be a beneficial win to you to set you up for success in your career. And as we'll talk about a little bit later, it also gives you a lot of variety and opportunity in your residency training. So as I've mentioned, Intermountain is across many different states throughout the western region of the country, but we're going to talk mostly about the programs that are in our Utah-based area. So mostly in the Salt Lake City Valley, but we also will be discussing one located in southern Utah in St. George. This graphic here just shows you visually the various Utah region PGY1 and PGY2 options that we have. And I'll talk a little bit more about the PGY2 options shortly. But in terms of PGY1 options, just to orient you, we have hospital-based programs that are listed here on the screen with these arrows. And the majority of those are accredited as a multi-site, meaning that it's one accreditation number from ASHP because we have the same standards, we follow the same practices, and they're geographically located close to each other. We also have a hospital-based PGY1 program in St. George, which is southern Utah, and that program also follows the exact same standards and is part of our overall residency organization. But because of the geographic distance, it's about 4 hours, 3.5 to 4 hours south of Salt Lake City. We just couldn't get that into the multi-site, but it's all the same. So when you think about our hospital-based PGY1 residency programs at Intermountain, really you can think we have 6 different hospitals that are all in that same bucket. We do also have a PGY1 community pharmacy residency, which takes 2 residents, and a combined year PGY1 and PGY2 medication use safety and policy specialty residency as well. Diving more into depth for our PGY1 programs and talking about some of the various locations, we house residents in 6 different hospitals, which I mentioned. And so Intermountain Medical Center is our largest hospital facility in the Utah area, and they take 5 PGY1 residents. LDS Hospital takes 2 residents, and then McKay-Dee Hospital, which is a little bit north of Salt Lake City, also takes 2 residents. Primary Children's Hospital is our dedicated pediatric facility in Salt Lake City, and they take 2 residents focusing on pediatric specialty, PGY1, obviously. Utah Valley Hospital is a little bit south of Salt Lake City in a town called Provo, and they take 3 residents. And then, as I've already mentioned, our southernmost hospital in southern Utah, St. George, takes 1 resident. And like I've said, all the standards for our residency program is the same across these facilities. All the residents work together, see each other a lot, um, and collaborate. The difference really comes down to the hospital look and feel, the geographic location. Some of the services offered certainly differ as well. And then, another thing to consider may be like staffing differences and what that looks like and stuff. And we'll talk a little bit about that. And then, as I've also mentioned, we have 2 other PGY1 programs. We have 2 residents in our community pharmacy program, and then one resident who commits to doing a 2-year residency that first year and then second year in medication use safety and policy. Many of our first-year residents do end up early committing to a PGY2 program, and most of our PGY2s offer early commitment. That may vary from year to year, but we are now up to 8 separate PGY2 programs, and then 9 if you count that second year of that combined medication use safety and policy residency. So we offer a pretty wide variety. So we've got 2 residents in AM care, 2 residents in cardiology, resident in critical care, infectious disease, pediatrics, 1 also in emergency medicine. And then our newest PGY2 programs are around psychiatry and solid organ transplant. We do have hopes to continue to expand these PGY2 offerings, probably an oncology program at some point in the future, for example. All right, so now that you understand a little bit about what Intermountain is, where we're located, and where some of our residents are housed, let's talk more globally about our residency programs in general. So we really are dedicated to making sure that we are preparing residents to be future highly successful practitioners in the field. And you're probably no stranger to the fact that healthcare and pharmacy in particular is changing rapidly. So we really strive to make sure that you're prepared for that. And as an offshoot of that, we've created 4 vision statements, really, or 4 key components to our vision that we use as guideposts when we train you as residents. And the first really is to provide the best learning environment that we can for you. There's you have a lot of options when you're looking for a PGY1 residency, and you want to make sure that you are getting the most value out of that training experience. And we feel very similarly. We know you're not giving up a year of making a really good salary or whatever, and working really hard and a lot of dedication to not get anything out of it. So we want to make sure that you are learning the most that you can, and that we're tailoring the experience to you and your needs as much as we can as well. Part of the way we do this leads into the second component of our vision, and that's to make sure that we provide you with the greatest number of opportunities and leverage our systemness as much as we can. So as I've mentioned, Intermountain is a very large integrated delivery network. And I mentioned all the different sites of care and types of services that we offer in terms of home care, acute care, clinics, etc. And so as a resident within our organization, you really have the opportunity to rotate at any of those locations and facilities. And I'll talk about in a minute, but you'll actually get 5 different electives. And many of our residents choose to go outside of their home-based facility to explore what practice looks like throughout other parts of the organization. We have also set residents up with external rotation opportunities as well. Civica RX, the generic drug company that Intermountain helped found, is one example, as well as the local Utah Poison Control Center. A lot of our residents like to rotate through there as well. And then, as I've already highlighted, pharmacy practice is changing rapidly, and you're going to get a pretty good clinical experience probably wherever you do your residency. You're going to know how to treat pneumonia, how to dose anticoagulation, etc. But we also really feel that it's important to make you well-rounded practitioners as much as possible. And there's a lot of other things that goes into being a highly functioning pharmacist besides just your clinical knowledge. So we really try to focus on those things as well throughout your year, and I'll highlight how we do that in a few minutes. And then we really like to compete nationally. We want to make sure we're the best program possible, and that when you leave, you've trained somewhere with a great reputation. So this sort of begs the question, okay, well, you've mentioned a little bit about the program, but really hone in on why should I consider Intermountain's Utah-based residency programs? What really sets them apart? And one of the things I've already mentioned is the large variety of learning opportunities that we have. You can rotate through any site of care within the integrated delivery network. So for example, some of our hospital residents actually like to do a rotation in home care and hospice at least once, because that's where a lot of care is shifting. If you've ever heard of the hospital at home movement, there's a lot more of that going on, and people getting hospital level care in the comfort of their own home. Um, Obviously, a lot of ambulatory care rotations as well are options. There's the aligned payer that I mentioned, so Select Health, and many of our residents are interested in learning, gosh, well, how does the payment models for healthcare work, and how does that look for pharmacy? So you're not just limited to doing hospital or acute care rotations, and you should really leverage the opportunity to branch out to other things. And then, as I've already discussed as well, you have a home-based location when you come to our residency program, and I'll talk a little bit more about how those home bases are determined. But you don't just have to stay at your home base. We allow you to do any number of off-site rotations. So some people do, 6 of their 10 rotations at their home base. Some do only 3 of their 10 rotations at their home base. It's really up to you and sort of what your growth needs and interests are. Another thing that I think really sets us apart are our dedicated and qualified preceptors. We have well over 230, I think now, board certified preceptors across our organization. And they really have a lot of experience training residents. We've been doing this for 20 years now and have graduated quite a number of residents from the program. And so our preceptors really care, and it's one of the reasons I love working at Intermountain, certainly. Another thing that is a really big benefit of our program, I think, is our focus on wellness. And we've been honing our strategies here for a number of years, actually. And it's really been a success, I think, and has helped our residents become more resilient as they head into the challenges within the healthcare environment and try to navigate the stressful waters of a residency and transitioning from a student to a fully autonomous practitioner. Some of the things, for example, that we've done is we actually have an established relationship with our Employee Assistance Program, or EAP, which is a group of therapists and counselors, and we make sure that residents get set up with an EAP counselor during the fall of the residency year so that they have that established relationship and someone to talk to and that opportunity. Through our core curriculum didactic education series, which I'll mention shortly, we also bring in different guest speakers to talk about resilience and how do we manage change and those types of topics, really to make sure that you have some tools and resources to take with you throughout your career. Another example would be some of the team building activities and group things that we do. There's actually a lot of literature to show that isolation and not having a strong network really amplifies rates of depression and anxiety in resident learners. And so we really focused on making sure that you have team building opportunities throughout the year and that you're all connecting as a residency class as much as possible. And there are more things I could discuss, just can't in the interest of time, but I think wellness really is an important component of our program. We also have a continuous improvement mindset here. We have changed the program sometimes considerably year after year based on resident feedback, our own experiences, different trends in the industry. And so we're always improving to make sure that you have a modern experience and an experience that meets the needs of being a functioning practitioner in the marketplace today. Another really cool thing about our program is that we have a pretty large residency class. So we have now, I think, 17 different PGY1s that rotate with us, plus all the PGY2s. But you get a small feel at your home-based facility, and then you get the larger residency feel when you want that as well, since we all come together as a big residency class frequently. So I think that duality of having a small knit group, but also access to a larger network of resident peers is really beneficial, and is a cool thing for our residents. And then as I've highlighted previously, Intermountain, I think, really has a great reputation, and we've been doing this for a while. We also have a lot of high marks for quality within our different facilities. We do take residents from all around the country, and so when you come do your residency with us, we usually have a pretty fun and diverse residency class, and you can see here just some of the different locations that we've had residents come from in the past couple of years. So now that we know why our program is a really cool place to train, let's talk about what that training actually looks like and what the residency requirements are. And again, these are the requirements for the hospital-based PGY1 general pharmacy program. So one of the key requirements, of course, is to complete rotations, and we do rotations in 4-week blocks. You'll have 5 core rotations that will be required for everyone, and these include pharmacy practice management, internal medicine, ambulatory care, critical care, and drug information. And you can find a list of what counts as these core rotations online on our website, but it's pretty flexible. Critical care could look like a PICU, or it could look like a cardiovascular intensive care unit. And honestly, these are all, even though they sound like they're required, they are things you're going to want to take anyway. And we really feel are important to make sure you're a well-rounded practitioner. And then you get 5 different electives, which is quite a few electives compared with some other programs. And as I've already discussed, there are so many different options from across the system that you can choose from. We have some residents who do, informatics. We have some who do, home care, like I mentioned. We have a lot of different tele-based rotations now. So there's tele-ID, tele-critical care. So it's really your opportunity to branch out and maybe do some rotations in these emerging areas of clinical pharmacy practice, which is super cool. You also, of course, will staff during your residency, and this is really important for a growth standpoint, to make sure that you're a highly functioning practitioner, and really helps people become more autonomous and gain a lot of confidence when you're responsible for doing staffing on the weekend shift or whatever. That said, there is still backup support that's provided to you. The exact staffing model will vary depending on the facility. And so that's something you'll definitely want to ask our site coordinators about and read more about online. They don't have time to go into all of those separately, just in the interest of time here in this presentation. But generally, for most of the facilities, it's going to look like an every other weekend staffing situation. And you'll spend the first several weeks of your orientation doing training and making sure that you're comfortable and confident to do that effectively. Resident research is also really important to us here, and it's important that you know how to do either a research or quality improvement based type project when you graduate from your residency, so that you can then take those skills and use them in your future career. And so all of our residents will do a residency related project, go through the IRB process, and ultimately this will culminate in a publishable manuscript. You'll also present it at ASHP and a local residency conference or other state meeting. Kind of will depend on the specific year and topic of your project. And these can be clinical research, or it could be more quality improvement or that type of thing. So there's some flexibility there. You also will do a lot of teaching during your residency year, And this will also include you creating an ACPE accredited presentation that you'll give in the spring. We do our own ACPE accreditation here internally, and so that will be a really cool opportunity for you and a nice thing to add to your CV. There are some other requirements here, including presenting to our P&T committee, making sure that you are certified in advanced life support. Obviously, it's important to make sure that you've attained the goals and objectives for the residency that's set out by ASHP and you're achieving those. And then in terms of teaching activities, I've already mentioned the ACPE accredited presentation, but there are other required teaching activities as well, including precepting a learner on rotation, for example. And we like to make sure that you're actually giving that learner evaluations and taking ownership there. I'll talk about the core curriculum session in just another slide or two, but to continue the thoughts around the teaching requirements, many of our residents are interested in maybe going into academia at some point in their career, and so they choose to opt into our optional academic teaching certificate program. So this really takes some of the core teaching stuff that's required for everyone and then amplifies it a little bit with a spin on maybe more of a didactic academic model for those who are interested maybe in becoming a faculty member of the College of Pharmacy. So this will mean that you're actually paired. So for those who enter the program, you'll actually be paired up with a faculty mentor. You'll write a teaching philosophy, develop a teaching portfolio. There'll be some extra learning sessions that you'll attend where we discuss different things. For example, at one point we bring in faculty members from various colleges of pharmacy and have a panel discussion on promotion and tenure and that kind of thing. So you really get sort of an inside look at what that's like. And then you'll also deliver a lecture at a local college of pharmacy and facilitate different student recitations and things like that. So, there's a lot more here to this academic teaching certificate compared with just the regular teaching and precepting that everyone does. But for those who are interested in maybe going into a faculty position, it's really beneficial. Now, one thing that I've only briefly talked about so far, and I want to just dive into in more detail, is our core curriculum residency conference series. And so what this is a regularly scheduled didactic session where all of our residents will come together and we focus on different topics throughout the year to really help make you or encourage you to be those well-rounded practitioners and really help you develop some of the quote-unquote softer skills in pharmacy. This year, we're doing them almost weekly for an hour. Most of them are virtual, but at least once or twice per quarter, all the residents will get together in person to see each other for maybe a longer session, and then a lot of them will go to dinner after and that kind of thing. But you can see here the 6 different domains that we have in core curriculum and that we focus on. Teaching skills is one of those. So for example, we'll start out the year making sure that you know how to develop objectives and use Bloom's taxonomy effectively, and what are some best practices for developing PowerPoints, that kind of thing, so that when you're doing your teaching activities throughout the rest of the year, you're set up for success there. I've already mentioned, and that also includes precepting stuff as well. And I've already mentioned wellness skills. This is where we bring in some of our therapy counselors and do some discussions on managing change or transitioning in stressful environments, that kind of thing, just to help give you additional tools that you can then take with you. Professional skills might look like CV and cover letter writing guidance, stuff like that. How do you think about doing advocacy in your career? What do you need to think about for professional growth in the long term? So we'll bring in some speakers to talk about that. And that relates to some of the leadership skills, which is the next core competency here. How do you effectively lead people, for example? How do you think about being a pharmacy practice role model? These are all things that are going to be put on your shoulders at some point. And so we bring in people to really help guide you or give you some things to think about. And then research skills is a really big focus throughout most of the core curriculum series. We know that most residents don't have a lot of experience doing research or quality improvement. And so we schedule different sessions throughout the year to really focus on that. You'll learn how to use Excel and effectively collect data. We'll actually teach you how to run some statistics on your own and set up an IRB protocol, all of those types of things. And then we'll also talk about, how do you develop a poster presentation or a platform presentation? What are some best skills and practices there? And then also intermixed throughout, we do different clinical-based topics and pearls. We know not all residents, for example, will choose to do a rotation with parenteral nutrition. And so we bring in someone and we make sure that there's at least core baseline knowledge for our residents to know what to look for in TPN compounding and stuff like that. So our residents have really enjoyed this and we continue to evolve it every year. All right, well, that was a lot of information about the program. Hopefully it was helpful. You can find additional details on our website, and then happy to talk to you at mid-year or one of our virtual open houses or just offline via email. But I do want to just wrap up by talking a little bit about what our matching and interview process looks like. So it can be a little bit confusing because of our multi-site accreditation, but in short, you'll submit your application through Forecast, and you can see all the application requirements and details of that on our website and also within the Forecast portal itself. If you're applying to one of our 5 facilities in the multi-site designations, that's Intermountain Medical Center, Primary Children's, LDS Hospital, McKay-Dee Hospital, or Utah Valley, you just pay the one fee there, and you can specify which of the 5 hospitals you're interested in. So some people want to end up applying to all 5 of those hospitals within the multi-site, and some might just say, no, I'm only interested in 2 based on what I know about the staffing model there, or just the feel I get from the small community hospital versus our larger academic medical center. So you can kind of pick and choose there. And then the St. George program, because that, even though it's the same standards and part of our overall PGY1 hospital-based programs, because it's not part of the multi-site, because it's too far away from Salt Lake City, there's a separate ASHP code. So that would be a separate Forecast payment and designation there. And so then after you have applied to the different hospitals within the program, whether that's all of them or just 1 or 2, we review those applications at both the system and site level, and then we invite candidates for interviews. You may be invited, if you've applied to 6 hospitals, you may, in theory, could be invited to all 6 hospitals to do an interview. Or just based on some local differences in terms of that application assessment, you may be invited to 2 of the 6 hospitals. So it kind of just depends. Usually we interview a significant number of people who have applied. So you do have a likelihood there. Generally, in the past 2 years, we have been exclusively doing virtual interviews, but this coming year for 2023, we'll be offering both virtual and in-person interviews again. So that will be a nice option. And then after the interviews have finished, you would go into the National Matching Service and say, okay, well, I was able to interview at 5 hospitals within Intermountain's program, and then you will rank each hospital. So it's not that you just rank Intermountain, you actually rank, I liked Intermountain Medical Center the best, followed by McKay-Dee Hospital, followed by, etc. And so you do those rankings by facility. And then the facility staff will also rank all the candidates. And then the National Matching Service will match it up. So that's how the home bases are determined. It's not that we don't assign those to you when you come. They're assigned based on the National Matching Service rank process and those algorithms. If you have additional questions about this process, happy to go into it in more detail or discuss your specific situation. Well, I know this was a lot of information to throw at you, so I'll just leave you with some parting words and advice. And that is residencies are hard work. If you're expecting just to, come and breeze through with a, 9 to 4 p.m. work schedule, um, and not work hard, then I would encourage you to reconsider, especially if you're wanting to come to Intermountain, because we have a rigorous program. We do focus on wellness and make sure that you're well supported, and we have high expectations for our residents. And it's a lot of work. It's a lot of long hours. You're trying to cram in 2 or 3 years of experience into 1 year. That's what a residency is. So just make sure you're coming at this with that mindset. You're going to do hard things. You're going to grow from it. It's going to be an amazing experience. And with that, I think all that hard work does pay off because you're going to really become such. It's going to propel your career. It's going to make you such an amazing practitioner, grow you as a person. And in particular in Intermountain, we work hard, but we also play hard. And so there's a lot of fun and games. Our residents love to get together. We do a lot of different activities. And I think we'd really enjoy learning more about you and having you here at Intermountain if you're interested. So thank you so much for your attention and looking forward to seeing your application soon.